Hello.
Good
Hi,
morning.
Christy.
Good morning.
Well, it's snowy again.
It is snowy and cold, but
Snowy and cold.
the sun is out.
Oh, really?
It's a beautiful day. It's a beautiful day.
I like that. I got in here before the sun really came out. So
one of those snowy, sunny days that I love. Cold, snowy, sunny days.
Yeah, that makes a big difference when you have some sunshine. Sunshine's good for you. It's good for everybody.
Oh, it is.
But it has a lot to do with mood. Has a lot to do with your vitamin D. But very much mood. When it's snowy and sunny, you get the extra reflection off the snow, which is that much nicer too. So.
Yep.
Well, we're here to talk about long COVID today.
Interesting topic.
Yes.
Very, obviously very prevalent.
Yeah, appears to be, and maybe something that we are not only going to be encountering from the last couple of years, but it could be a continuing problem as COVID seems to be getting less deadly but more prevalent. Some of these factors still come into effect. So we're going to be looking at a study today from back in 2021, August of 2021, so it's a little more than a year old now. But this is a Mexican study titled "The Development of Pulmonary Rehabilitation Protocol for Long COVID Patients." And I've been meaning to get through this one for quite a while, but we've just had so many other exciting studies to look at. It is time to go ahead and bring this one around because we've had a number of patients dealing with long COVID and symptoms after COVID. And COVID itself, of course, can have some pretty significant problems for people. So I figured this is good to look at. So if this is your first time hearing about long COVID, let's go ahead and just describe it a little bit here. They say that most patients do recover within 1 or 2 weeks from having acute COVID. However, in approximately 5 to 10% of the patients, some of the symptoms persist for weeks and months and develop post-COVID syndrome, which is known in the literature as long COVID. According to the CDC, long COVID is a set of symptoms that persist or develop 12 or more weeks after the onset of COVID-19 that cannot be explained by another cause. So that's 3 months or longer.
Are the symptoms different?
They say the symptoms can include fatigue, respiratory difficulties like shortness of breath or just the perception of just not being able to get enough air, cough, pain in the chest, tingling in the limbs, digestive disorders, anxiety, and depression.
Wow.
Yeah, and I've seen a couple of cases that had really severe headaches, and like spinal type pain as well. So it can really be all over the place. That's one of the problems with long COVID is that there's just a lot of variety that can happen, and it can be 3 months or more after you've already had and recovered from regular COVID. So the real key phrase there becomes, that cannot be explained by another cause. If you're having problems like this, difficulty breathing, digestive disorders, depression, tingling in the limbs, don't just be like, oh, it must be long COVID. Definitely get checked out because there can be other problems that come up too. But the difficulty is there's no test for long COVID. We have a test for an acute infection, right? We have tests for that, but we don't have a test to really show if your body is reacting to the COVID problem that you had that is now gone. Right? The infection is gone, but this is kind of a point where your body overreacts and tries to attack anything that might be suspicious, and we see this in the acute phase of COVID as well, with some of the acute respiratory problems that happen, which is typically why people pass away if it's due to COVID. But this is a problem, an inflammatory problem that is ongoing after your body's already recovered, right? So,
and it doesn't matter to what degree you had COVID, mild or severe, or does it matter?
It doesn't really seem to matter.
Okay.
That's exactly right. So even if you just recovered really well, there's still the possibility that you could be dealing with long-term problems later and you're not going to really know it. So part of the battle here is education, right? So that people don't think they're just going crazy, that perhaps there is an explanation for these problems that they're having, 3-4 months after they've had COVID.
It's that unknown that is so hard.
It is.
Really.
Yeah. Yeah. So being aware that this is a possibility, I think is helpful for people. Another quote from the study here, they say that infection triggered perturbation, which is a difficult word, perturbation of the immune system could induce psychopathological conditions in patients with COVID-19. According to the latest research, a significant number of patients reported depression, anxiety, and insomnia. So, the problem with this is not just a physical problem. It's not just an immune system problem, but it seems to actually affect the way the brain works, and the way that we kind of interact with our surroundings. In fact, that anxiety and depression can become major factors for people with long COVID.
Well, and it probably is intensified this time of year during the winter seasons. The darkness. I don't know. It's just a thought that popped in my head. I wonder if that could be a factor, because people do get more depressed in the winter season.
Absolutely. Yeah, really anything that would exacerbate a depression or anxiety issue, like weather changes, lack of sunshine, just stress, personal events, things go on, your kid gets in a car wreck and they're hospitalized or something. I mean, those major stressors like that, or even just the little stuff. Somebody cuts you off in traffic,
It doesn't have to be big, just cumulative.
It is, yeah, absolutely. And long COVID anxiety is really no different than anxiety for any other reason. So anytime you're dealing with anxiety and depression, those triggers can be a significant factor for exacerbating the problem, prolonging the problem, and kind of keeping people from really getting back to themselves. Yeah. So, what do we do for it, though? How do we fix long COVID?
That's the big question.
Right? Well, right now, there are a few medications that seem to help a little bit. They also say counseling is good for the depression and anxiety side. I'm not going to say that's not good. And then some relaxation techniques. But generally, there's no specific drug for long COVID. You're just using the medications to help fight the symptoms. So in a lot of cases that means anti-anxiety meds. Sometimes some other medications to try and help the body kind of recover from the inflammatory side, non-steroidal anti-inflammatories, prednisone, things like that. But again, all of this just kind of addressing the symptoms.
And those all come with side effects.
Yes, we do. We do know every medication has side effects. Some of them very minor, some of them very significant. But certainly something where if we can stay away from medications and still accomplish the getting better part, it would be great. So there are some physical modalities or actual physical treatments that can be done for this. And in the study, they say that the most frequently used physical modalities in patients with long COVID are lasers and high-intensity electromagnetic stimulation. So this is why I picked up on this study, because this researcher talks quite a bit about using lasers. They say that laser light can be used for biostimulation and pain relief. The popularity of the application of laser therapies is increasing due to lasers being a non-invasive, painless modality that can be easily administered, meaning that you don't have to cut anything. We're not burning, slicing, roasting tissues. It is simply delivering light to the target area in order to stimulate the body's biology in a way that helps it recover and go back to its normal functioning. Now, they do mention the high-intensity electromagnetic stimulation therapy too, and that is based on the interaction of electromagnetic fields that pass non-invasively through the human body and induce electric currents. This triggers an action potential process in the motor neuron and results in muscle contractions. I'm not going to spend a lot of time talking about this one today, but it is another non-invasive therapy that doesn't seem to have really any negative side effects and may help with inflammation. They say that considering that the combination of peripheral application of this magnetic field therapy and laser therapy enhances local blood circulation and induces an anti-inflammatory effect. The goal was to eliminate the chest pain that goes along with long COVID and improve, in an indirect way, ventilation parameters. So helping patients not only recover from the chest pain, but also helping them breathe better, improve just the way that the body is functioning, taking in air, and reducing inflammation. So using both of those modalities, both the laser and this magnetic stimulation.
So, well, I don't know where my brain went on that. How often do you need to do this?
Well, let's look at what these guys did.
Yep.
They say that they did a total of 10 visits to their facility in Tijuana, 3 times a week for 3 weeks. So in total, patients received 3 laser therapy treatments, 3 magnetic field treatments, and 4 TMS applications. Now, I haven't mentioned TMS, but TMS is just the same magnetic field, pulse magnetic field, but done on the head.
Okay.
In a way that it helps to stimulate brain patterns, right? And again, these are all non-invasive therapies. These are not dangerous. Even if we use them on the head, they're still safe protocols. So they used a class 4 laser, 30-watt laser, with a wavelength of 1,064 nanometers. So it's an infrared laser. It's invisible, but it does pass right through the tissues without destroying anything, and can go into the deeper tissues like the lungs without any kind of problem at all. They applied the therapy on the chest and on the back between the 1st and 6th ribs, so kind of the upper part of the lung. And gotta get my pages unstuck here. And what they said is that the major advantage of class 4 laser therapy is its high power and its ability to penetrate deep into joints and muscles and organs. Especially with the 1064 nanometer wavelength, they say it has the ability to penetrate into deeper tissues, reduce pain, reduce inflammation in areas such as the lungs. And again, very safe. There is some warmth that people will feel with the treatment, as you know, because you've done laser therapy for a long time. But it's completely comfortable. So let's talk about the results. So they applied these, a series of just 3 laser treatments, a few of these magnetic field treatments, and they saw some pretty substantial results. The easiest way to look at this is actually on the graphs that they produced. So I'm gonna bring those up right now, if I can. There we go. So this is the chest pain evaluation. The before is the really tall stack on the left side there, and then the after treatment pain level is on the right side. So generally, people went from about a 7 or 8 out of 10 down to about a 1 out of 10.
That's pretty substantial.
That's very substantial. Yeah, absolutely. And that's again over just 3 weeks after dealing with this long COVID problem for quite a while. So that right there is really good. They said in particular that these results provide evidence that treatment with this class 4 laser had a significant effect on decreasing the VAS score, the visual analog pain scale, of chest pain in long COVID patients. So in particular, the effects of laser in this case were for the chest pain itself. Now they did measure a couple of other things as well, one of those being anxiety. And here you can see the anxiety scores dropped substantially as well, from very, very high into the very, really pretty minimal area there. The other thing they measured was the ability of the body to bring in air and how well perfused the patient was. So on average, people increased from 95% to 98%. And again, this is an average of all the people that were involved with this study.
Still, even though it sounds like a small percentage, it still is pretty substantial.
It is.
Because the air is always a smaller differential.
Yes, that's exactly right. So, a 0 out of 10 on the pain scale means you don't have pain. 5 out of 10 means you have quite a bit of pain, right? If you're at 50 on the oxygen percentage, you're dead. So, I mean, there's really the scale is different. So in this case, going from 95 up to 98 is quite a bit of improvement, especially considering once you're at under 94, we know you have problems. You know, so going up into that very healthy range, this is a pretty substantial change for these people. You're looking at the total amount of decreased anxiety, decreased chest pain, and then improving the way that the lungs are working, improving the way that the body was able to get oxygen into the tissues. That's a pretty big deal, especially considering that you didn't have to do anything for years, or months even. Didn't have to take a bunch of medications.
Right.
Yeah.
And the side effects are just getting healthier.
Yeah.
Really.
Yeah.
You know, no long-lasting adverse side effects.
Right. Yeah.
So.
No, it's really nothing but positives for these types of therapies. Now, I know I didn't talk about the magnetic stimulation a lot, but that's because we are doing laser therapy on this one, and it certainly could be a tool as well. It's not really within my field of experience, but I do know that with laser we've seen some great results. So what are the takeaways here? The main takeaway is that we think laser may help quite a bit with chest pain, especially if there's some level of restriction in the amount of oxygen that's flowing. If you have long COVID, I would encourage you to consider this as a potential option for you. You know, we can't tell based off of this study if it's a for sure home run for everybody or not, but the numbers do look good, and when you start considering things like the side effects, laser therapy comes out quite well, and you should know within just a few visits of laser therapy if it's really better or not. So certainly worth something to take a look at. The other side of that is, you know, if we can improve the chest pain and we're indirectly improving the way at which the body can oxygenate the tissues, then other things improve too.
Right.
If you're constantly feeling like you can't get a full breath of air in, I mean, what does that do for your anxiety?
It raises it, plus it's the quality of life just
Oh, yeah.
starts going down. And so when you start seeing some positive turn, things just improve.
Yeah, absolutely. Absolutely. Well, if you're interested in learning more, you can get a hold of us at Laser Therapy Institute. That's we are a training organization for laser therapy providers across the world. You can go to our website, lasertherapyinstitute.org. You can look on our clinics tab for a clinic that might be near you. If you have questions that aren't answered there on the website, you can just email us to info@lasertherapyinstitute.org. We will be happy to help in any way that we can. We want to see people succeed through laser therapy. If you're a clinician watching this and you want to know what type of settings, what type of protocols can be used for disorders like this, like chest pain, get a hold of us, because this is exactly what we do. We help set up providers to be successful with their patients.
For sure.
All right. Thanks very much for joining us today.